More than 500,000 doses of the COVID vaccine have been distributed across New Jersey so far. The goal is to get 5 million residents vaccinated by May.
Yes, but serious shortages are forcing the city of Paterson to make do with less than just 1,000 doses. So joining us this morning is Paterson Mayor Andre Sayegh. Good morning, Mayor. Thanks for being with us. Always good to talk to you.
The pleasure is mine. Thanks for having me this morning.
Of course.
All right, let's get down to it. Paterson was forced to cut back on the number of days that the vaccines would be made available to the public. Do you expect the same thing to continue to happen this week?
Yeah, unfortunately, last week we had 2,000 doses. This week we have 700. So I've been on the phone with the governor's office. I've called our congressman who's always advocating for us. And I want to wish Congressman Bill Pascrell a happy birthday. And he's taking the fight to Washington. Obviously, it's a matter of the federal government distributing the vaccine. And I'm encouraged by the fact that President Biden has said he's going to invoke the Defense Production Act to accelerate distribution. That will go a long way in getting us to get shots in people's arms.
700? That's the amount you're getting this week. How many people actually want the vaccine in Paterson? Do you have a number of people who have requested it? I understand people are trying to log on and they're even having difficulty making an appointment. Yeah,
I'm glad you said that. The appointment system has been plagued by problems, but I can tell you hitherto, we have vaccinated over 6,000 people. Demand is very, very high.
Yeah.
There have been days where we run out of supply and we just have to close our point of dispensing. So we don't want to do that. There is a supply-demand imbalance, so it's got to get to a point where we can meet the high demand.
So how are you actually scheduling it? Is it still the way the categories go with first responders and frontline workers first, 65 and older? Like, how are you deciding who gets that 700?
Exactly. The expansion of eligibility includes all of those individuals that you just listed, and also anyone with a medical condition defined by the CDC. So ages 16 to 64, we accommodate them as well. And then smokers, don't forget smokers.
They're on the list, that's for sure.
And we're getting people that come up, people say, well, I smoke hookah. Okay, well, you're a smoker.
They're just trying to get in line. Hey, Mayor, let me ask you, though, that being the case, what about folks who got their first shot and need that second shot? Is that problematic for you now?
Wow, what a valid question. You must have read my mind. Today, we're starting with second doses because we were inoculating people on Monday, December 28th. That was the first day. So we have Moderna, so it's 28 days, and today is the first day for second doses.
Do you have enough?
Yes, we do. Yes, we do.
I'm confused, Mayor, by the number, right? The 5 million by May. The country as a whole wants to have 100 million in a first 100 days. Do you see as any of this is feasible with the way the current numbers are rolling out?
Well, like I stated before, President Biden, that's why I'm encouraged. If he's invoking the Defense Production Act, I think we stand a chance. It's good to have somebody in the White House who relies on science and data when making decisions. So that's why I think we can breathe a collective sigh of relief because we got President Biden making decisions.
When you look at that 700 number, I'm sorry to focus so hard on that, and we have all those.
I was focused on it too.
Yeah, and you have all those people who are in the category, right? That's a lot of people, especially when you factor in the people who are over the age of 65. How do you ensure somebody is more important to get it than another? Is it just the honor system of first come, first serve?
Yeah, that's exactly what it is. First come, first serve. We've had people line up as early as 4 in the morning. And seniors, we accommodate them. If they've been online for quite some time, if they need the assistance of a wheelchair, or if they need us to bring them in just so they could stay warm, we've done that.
Yeah, I wanted to ask you that because it's supposed to get super cold later this week, down to the single digits. I mean, how are you going to be able to do this, especially with those who are immunocompromised and the elderly standing in line as they need to in order to at least attempt to get a vaccine?
Man, you're spot on this morning. So what we're doing is we're going to, I wish I had a semblance of your intelligence. So what we're doing is at the site, we have a large high school and not all the rooms are being used. There was some concern. So we're going to work with the school district to make sure that we can make more space available for particularly senior citizens, because we know they are the most vulnerable.
Yeah.
And we knew that there was that issue you referenced it to with the log-on system, right? So now this morning, the phone bank system, it's been open for about 20 minutes so far. What do you know about the phone system? Hopefully it's staffed by 250 people, but hopefully it'll go a little smoother.
Yeah, I know the phone system, from what I understand, has been inundated, but they're in the process of trying to troubleshoot. So I'm cautiously optimistic that they can get that back fully operational again.
All right, Mayor, as always, we appreciate you coming on the show. I know you speak as openly and honestly as possible, and that is definitely appreciated.
Thank you. Take care.
Have a good day.
Stay safe.